Dr.Reyna Mehta. I'm the Vice President of the Global Working Group, and this is the first ever event of the Global Working Group called UpSurge Resume. It's to build your resume specifically based on various countries, not as a generalized CV building, specifically for medicos and for specific countries. So it's easier for you to get into a country and apply for a training. This event would specifically be focusing on your CV building for training in the United Kingdom. And right now we have with us Dr.Yuva Ravindran. Ma'am, can you switch on your camera?
Hi.
So, ma'am is a graduate from Tamil Nadu. She's also registered in the General Medical Council in the UK. She starts her FY2 CT1 medical rotations in the Midland, UK. She is also a fellow of Harvard Medical School, has been coined COVID superhero by the national media. She's also published 8 international and national publications. And to top it all off, she is an all-rounder. She's been a Miss Tamil Nadu finalist for the Talk of the Year of 2021. So, ma'am, I'm hoping you provide us with the most insightful CV building experience for training in the UK. I'd also like to mention all the members, kindly please mention your full name as your profile, so it's easier for us to provide you all with certificates later on. Also, please don't leave the chat. We will love to have a screenshot for our social media, so kindly stay here. Also, will be the flow of the events would be that ma'am would be discussing the entire event of the CV building workshop. Y'all can mention any queries you all have in the chat while we move along. The Q&A session will be after, towards the end of the session, once ma'am is done discussing all the CV building activities and everything that we can do. And that is when we'll be addressing the questions, followed by a closing session. And also please be there towards the end of it, so all of us can take a speech. So ma'am, handing it over.
Yeah, thank you so much for that introduction. Without wasting much time, I'll just start with the PowerPoint so that we will be able to finish it in time. And before I start, hello all, I'm Yuva, and Reyna just gave an amazing introduction for me. Thank you for that. And I will start with my presentation now, but if at any point if you think I'm going fast, or if you've got any doubts, drop it in the chat box, and the host, if you want to interrupt me at any point, just feel free. And this talk will only be an overview, like I can give you an idea of what is required in the NHS, but of course for specific persons and for specific fields there are minimal changes. I'll just start, because this is Global Surg Network, I will touch on medical requirements and surgical requirements alone. Like there will be little bit changes if you want to pursue pediatrics or OG or radiology, like that. But then I'll just tell you how things work in the UK, like an eagle's view, like a bird's view. I think I'll start now. So CV requirements in the NHS. Before I go to the actual topic, I will give you an idea or an overview about how or what you should do to enter the NHS. So there will be a few abbreviations here. I'll explain it right now before I start, or in the first slide itself, so that you get the flow of it while I talk. IMG is an international medical graduate, and NHS is the National Health Service. So as an IMG, how do you enter into the NHS? There might be a lot of questions that you have. The basic question that all of us will get is, who is an IMG? So an IMG is anyone who has completed their undergraduation outside the UK. Like, even if you're a British born, like you were born and brought up in the United Kingdom, but you came to India, or not just India, even if you have gone to the United States for your undergraduation, or any developed country, developing country, basically anywhere outside the UK, that also includes Ireland, which is which a part of it is a part of the UK. There's like 2 parts of Ireland, Southern and Northern Ireland. But if you have completed your undergraduation in Ireland also, it is not considered valid. So an IMG is any person who has completed their undergraduation outside the UK, and any medical degree outside the UK is not considered valid. So what do you do? Like, I've completed my MBBS, but now I want to practice in the UK. So this is the basic steps that we do. That is, take IELTS and IELTS or OET, take a basic English language test, get the required score, and then clear your PLAB 1 and PLAB 2 exams. So you might ask, like, I'm in my second year, I'm in my third year, I've completed my undergraduation, I'm working now, or I did my undergraduation in Russia, China, or in India, and am I eligible? The answer is, any undergraduate from any country is eligible to take PLAB, but you should have completed your internship, or in other words, you should be an undergraduate. Like, you should have gotten your degree before you can take PLAB 1 or book your PLAB 1 slot. Like, you cannot take PLAB 1 while you are in second year or third year or in final year. You have to complete your internship and then get your degree. Only then you can apply for PLAB 1. For some uh, countries, like for example in Ukraine and in the Caribbean countries, they give them the MBBS degree even without internship. So in such cases, those candidates, you can apply for your PLAB 1 after you finished your final year. So in simple words, you have to take your PLAB after you got your undergraduate degree. And what do you do after that? So once you finish this streak, like once you give your IELTS PLAB 1 and PLAB 2, you apply for GMC registration. GMC is like the MCI or the NMC of India. It's the Medical Council of UK. So you apply for your registration and you take a job there. So this is the general outline or the flow with which we all follow. So is an amazing profile or a very good profile needed to enter the NHS? The simple answer is no, not at all. Like I just said in the previous slide, the eligibility for you to enter into the NHS or to secure a job there is your undergraduate degree, your MBBS with plus 1 year of internship. That is what is required to enter into the NHS. Entering into the NHS means securing a job there. For that, you do not need a good profile or you do not need anything at all. All you need is your MBBS degree. So like I said, you get your GMC registration. That's the number that they give you, like the license number that we have, like your name followed by the number that is given by your state medical council. Similarly, once you finish your PLAB, UK will give you a number. Once you've gotten the number, you're eligible to work in the UK. So after the GMC registration, you apply for jobs of a foundation years. Foundation years is equivalent to the internship that we do in India. It is not mandatory that you have to do an internship again, but all of us do that, so we get an idea of how the NHS works. Like, the NHS is a totally different setting. It's completely different. So it is not recommended that you straight away enter into post graduation or you enter into a really responsible job, because the dangers of getting into a litigation is very high there in the UK. So it is better that you get your GMC registration and then apply for a job, preferably an internship year 2 job. So if a good profile is not needed, what do I need to secure a job in the NHS? The answer is, you need to have work experience and some life skill courses. And by life skill courses, I mean the ALS courses and the BLS courses that we take. Although it is not validated in the UK, any course that is taken outside of UK is not validated, but still it gives you an edge while you apply for jobs. And work experience is required. Again, it gives you a really good impression if you work in the field that you want to pursue. For example, I want to do masters in medicine. So after I finish my undergraduation, it is better to work in medical department. Like in a hospital, I can work as a junior resident in general medicine, and I can include that in my work experience. This is all that you need to enter into the NHS. So what is this whole talk about? Like, why do you need a good CV? So this is the thing. You do not need a good CV for your PLAB. You do not need a good CV to enter into the NHS. You do not need a good CV for your first job. You need to update your profile, or you need to do everything to keep your profile really good, look good. That is only required when you apply for training courses. And training is the word we use in the UK for postgraduate programs. We never say MD medicine, MS surgery, or I'm PG first year, PG second year. Instead of that, we call them course training or specialist training. Like, core is the subject, like my core is medicine, my core is surgery. So training means the person who is doing their post graduation. So it's like CT year 1, CT year 2, CT year 3. That is how it goes. So when you apply for training courses, for example, in India, when you want to take your post graduation, you take NEET, and it is based on your marks that they give you a seat. In UK, when you apply for training courses, they looked at your CV, and based on your profile, they shortlist you. That is when CV comes into role. And if you ask me the years of training, or is it like if the training is similar to how it is in India, it is a totally different talk. I will have to do a separate talk for that. But in simpler words, the years of training differs for different specialties, but for internal medicine it is 3 years, for surgery it is 3 years, for pediatrics I think the complete training includes 8 years, something like that. And for psychiatry I'm not very sure, but I think it's 5 years. So it depends on the department that you choose. But by core training or specialist training, we mean only the MD level, like the postgraduate thing that we do here. That does not include DM. That is the next thing. So to enter into core training, you need a good CV. So now I will go ahead and go to the actual talk on how to make your CV good, or make it get shortlisted. And how do you apply for training? This is the talk about, because after you make your CV ready, you apply for training. So there are official websites for training in medicine, training in surgery, and in different fields. In whichever field you want to apply, you go to the official website. And every year during November, or during the year end, like October to December, the application process starts. Like it opens, the website opens, where you can submit your profile and you can wait for them to reply. And the application process goes like this. You log into the website and you submit your profile, and it has got multiple criteria which I will be discussing in the further slides. And you say that you have all of this, but it's not just okay if you say that. For example, they're asking you for a presentation, you say I have done this presentation when I was in second or third year. They don't accept it. You need to provide them with proof as well. Proof or evidence is very required in the UK for whatever I do. For example, I've given this talk, I go and tell my consultant that I gave a talk for a network. They're like okay, but that does not mean that it is true. So if I've given this talk, I need to submit them a certificate or a feedback form. So for everything, make sure that you collect evidence right away when you're doing it. So that is one thing. And so you update your profile, you upload your profile with the criteria or with the points that you have, and then you tell them that I have all of this, so you need to give me points. So that is what we do, like from our side. And after the profile is uploaded, there's a close date for applications, and after the close date reaches, the consultants or the committee, whoever is looking after this, they look after your profile, and if they feel like okay, this person's profile is good, they shortlist you. And even after that, it means that you're not entering into training. It's like step 1 is clear, and step 2 is you'll have an online interview, sometimes offline. But now because of COVID, everything is made online. And after that, you go for the interview, and if you get selected into the interview, you enter into training. This is the entire cycle. So here I have, in the previous slide, in this slide, I have told you that you upload your profile, and there are multiple criteria with which you can claim points. That is what I will be talking about. That is the equivalent of CV building. So these are the criteria that they look after. So just a second, I'll move this down. Right. So this is the overview of the scoring system. These are the points that they take into consideration. You may make a note of it, because this is where you have to concentrate. Like distinction, I will discuss each of them specifically in the upcoming slides. They include distinctions during a medical school, undergraduate and postgraduate degrees other than MBBS, presentations, publications, teaching experience, leadership experience, and there's something called audits or quality improvement that is a part of the curriculum in the UK, but in India it is not done everywhere. But that's all right, I will come to it anyway. So moving on to it, the first thing is there might be, like, you might get distinction and honors and everything, but unlike India, where getting distinction and honors is considered very good, and it's like, oh, this person is a really talented person, really studious person, it is not the same way in the UK, because it is just one of the scores of training. So how do they separate, or how do they give you scores? So the 6 marks, like the 642 are the scores. So the 6 score is the highest when it comes to undergraduate distinctions and honors, but that is given when your overall percentage is more than your batch. Like for example, you have gotten honors overall from first year to final year. If your overall percentage is a distinction and or honors, you can apply for the high achievement award. And if you have been given any international or national prize, you can claim for four marks. And you've gotten like 6-7 distinctions, but still your overall mark will be 2. And there is one more catch here. Like if you have gotten 6 distinction, it's not like 6 into 2 12 marks, it is only 2. If it is 1, or if it is 2, or like how much ever it is, the score is just 2. You cannot say that it's 2 for every distinction. So this is what is considered while you do your medical school. This is in undergraduate education. This is one of the criteria. We will go on to the next one. I hope I am clear. So the next is undergraduate degrees other than MBBS. Some, like I said, for example, in the United States, you cannot directly enter into MBBS. They mostly do an undergraduate degree like a BSc or BA before they enter into MBBS. And this happens in the Caribbean islands also. Again, it's not like this all of this you must be having all of this, like you need to have a distinction, you need to have an undergraduate degree. No, you just try to enrich your CV as much as you can. It's okay if you don't have 1 or 2 points of it. So some people tend to have undergraduate degrees other than MBBS, so that can also be put into your profile. So if you've gotten a BSc or a BA degree with distinction and honors, it's like 6 points. You've gotten, so there's 1 point here where you can see you cannot claim for any membership examinations. For example, during a PLAB or right after your PLAB, you complete your MRCP, which is the master's exam for medicine. There's like 3 steps for it, 1, 2, and 3. Sometimes you can take your first step. Sometimes it's not sometimes, actually you can take your first step right after internship, because that's the requirement for it. So some people finish their MRCP right after internship while they're preparing for PLAB, but you cannot submit that as a master's exam and claim for scores. This is in case of medical training. But in surgical training, if you have applied for MRC, yes, and if you have cleared the step 1, you can claim for points. So that is one thing you have to note. So these are the postgraduate degrees that they consider, which includes any research degree with honors or without honors. And if you're doing medical training, you cannot claim for MRCP, but if you're trying surgical training, you can take your MRCS step 1 and ask them for points. Next is teaching experience. So by teaching experience, all of us would have done that, but we will not have done it in a very organized or in a very proper way. All of us would have taught our friends, all of us would have taught our juniors. So all of that goes to the last thing, that is, I have taught medical students occasionally, which is 2 points. But for example, if you have a network, or if you're doing a teaching in a very organized way, and you're doing it for more than 3 months, that's the highest point, that is 6. You are regularly teaching, but it's not very organized, you just do it when you have time, then you can claim for 5 points. So this is what teaching experience is about. And again, if you see, everywhere you need to have an evidence of feedback, or you need to get a certificate from the institution that you have taught, that you have been involved in proper teaching. And for all the previous slides also, for example, if you've done a degree or if you've got a distinction, you need to show them record, because evidence is very, very important, without which you cannot claim your points, or whatever you claim will not be taken legit. This is in case of teaching. I will move on to the next slide, which is leadership activities. So in leadership activities, you can even, there are 2 segregations again, which is national leadership or regional. Regional as in, for example, for India, we can say South Indian, or a state-wise leadership role. If you've been in a leadership role for 6 months, you can ask for the highest points, that is 6. Or if you were a local leader, you can ask for 3 points. And this doesn't specifically just include medicine only. Maybe if you have any other organizations, or if you've been a part of an NGO, or whatever it is, you can ask for it. All we can do is submit our papers or submit our documents and ask them for points, but we do not know what are the points that they will consider, because that is not kept very transparent. It is the committee that they decide, but we can try our level best. And here also, if you see, if you have been a local leader, that includes very small things which we do not give much importance. Like for example, if you have been your representative of your college for 1 year, you can even include that, because that is a local leadership. So while you're applying for training, before that, just collect or think about what are all the things you have done. Maybe they're very, very minute, or they're not considered relevant at all in India, but that's not how it is in the UK. Everything that you do makes sense there, or it is taken into consideration. So you can apply for it. Next, like the very important topic or the very hyped one, publications and presentations. And like I said, it is not like you need to have all of this, or it is must that you do a publication. If you have all the other things but you do not have a publication, then that is fine. So but in India, I don't know why there's so much hype about it, but of course we'll talk about it. Regarding publication, the segregation is quite elaborate. So some of the topics are like, for they are talking about two things in publication. One is publishing a research paper and publishing a medical related book. So both are considered equivalent, or both are you can claim points for both of it. So this might be a little bit difficult to understand for what, for example, for what they're giving 8 points or 6 points or 4 points. So I've made it in a very simpler form here, that is, whatever you're publishing, this is other than publishing a book. So the initial segregation is publishing a paper and publishing a book. If you're going to look into publishing a research paper, this is how the score goes down. Like for example, if it is a PubMed publication and if you're the first author of it, and if you have more than 2 presentations, then you can claim for 8 points, 2 or more of it. If you have a PubMed publication but you're not the first author, you are a co-author, and again you have like 2 publications, then you can ask for 7 points. And you have a PubMed publication, you're the first author, that's just one publication you've made, then you can ask for, I think it's here, so you can ask for 6 points. You're the co-author, then I think it will reduce by 1 point, which is 5. You have a publication but it's not PubMed, but still you're the co-author, you can ask, sorry, you're the first author, you can ask for 4 points. If you're the co-author or something, you can ask for 3 or 2 points. This is how publications work. Other than that, there is one more thing that you see, that's the second thing that I was talking about. If you have written a medical book, like for example, I've written at least 50% of a book that is related to medicine, you can ask for 6 points. You have written, and there's something else also, I have written a chapter of the book that is related to medicine, you can ask for 4 points. So this is what publications are about. You can make a note of it, but to make it very simple, make it very easier to understand, I would say, if you're trying to make a publication, like you think, okay, I think I have enough time, I can do a research and I can publish in some journal, make sure that the journal is PubMed indexed and make sure that you're the first author of the journal. And if you ask me where I should find, where I can find if the journal is PubMed indexed, you can just type it in Google, like type the name of the journal and just type, is it PubMed indexed? You will get so many links. Or there is a website itself like PubMed indexed journals, where you can open and type the name of your journal. If it appears, it means that it is PubMed indexed. If it doesn't appear, it means that it is not PubMed indexed. So this is for publications. Next is presentations. Presentations include any kind of presentations that you do. So again, we can separate it into oral presentation and poster presentation. Oral presentations get higher scores, poster presentations get lesser than the oral presentations. And if you've made an oral presentation in a national or an international meeting, you can claim for 8 points. Same oral presentation, but in a regional meeting, which is state-wise or zone-wise, then you can ask for 5 points. Or I think you can even apply, submit evidences if you have done it in an inter-college meet, which will come under regional presentations. And the second thing is poster. Poster that you have made in an international presentation, it is 5, and a poster that you have made in a regional meeting, it is 2 marks. So this is what you submit for presentations. After that, the thing that I was talking about, there is something called audits and quality improvement projects in the UK, which they do right from the medical school itself. It is a part of their curriculum and they have to complete it to get their competency form or to get their degree signed. To finish the internship, they have to do this. If you ask me what an audit is about, an audit is anything, or a quality improvement is anything that you do to make patient care better. That is like the simplest way I can put it. And it has so many cycles. For example, you're working in a pediatric ward and you find that everybody is making a lot of mistakes while prescribing fluids for pediatric patients, or everybody is finding it very difficult to remember the guidelines for it. So this is a problem that you're facing. So that is the problem. So audit goes like this: there is a change, there is an act and an action. So this is a little bit complicated. I'll tell it like a story in simpler words. The problem here is remembering pediatric fluids, or lots of mistakes in pediatric fluids. So this you have to document initially. So this is the problem and you want to make it better, so the patient care gets better. So this is the thing. And the second step that you do is find a solution for it. For example, you take a chart, you write the pediatric fluids and you paste it in all the pediatric wards, or you paste it outside all the pediatric rooms. This is the step that you have done. And after some time you go to these same wards again and you look at the response and you look at the number of errors that has been committed. And if there is a reduction in the number of errors, it means that your quality has improved, which is QI, which is quality improvement product. So this is a very, very simple explanation of an audit project, and it has like 5 or 6 steps when you dissect it or when you elaborate it. But this is how it goes. Like, you find a problem, find a solution for it, implement the solution, and then review the problem to see if it has gotten any better. So this is what you do. And if you have been a part of an audit project completely from the beginning until the end, you can ask for complete all the points, that is 8. And if you've been in like some parts of it, it is either 6. And if you've just been in like not greatly involved, but in some steps of it, it is 2. And for this 8 and 6, there are like the audit project, there are 2 steps. That is a 2-step audit project or a 3-cycle audit project. So if you're involved in 2 cycles, it is 6 points. If you're involved in 3 cycles, that is 8 points. If you're involved in some steps only here and there, then you can claim for 4 or 2 points. This is audit. So I think with this, I have completed the actual requirements, or what is actually important in the UK, or what is considered valid, or which are the factors that will give you an increased score when you apply for training. Other than this, like, if you have got any extracurricular activities, if you have got any other charity works or some NGO works, or anything that you think will improve your profile, you can just submit them. It might not give you a score, but of course it will make your profile look good, and it might help in other ways. Maybe not entering into training, but after you enter into training, they will be useful. So please do not think like, okay, these are the only things that I have to do. If you're really, actually, these are the only things that you have to do, which are like very direct and very reliable. But if there are other things that you want to pursue, please don't stop pursuing them, because just because there are no points for them. So these are all the factors that are taken into consideration, and we will go, I'll tell you how important, or if you need all of this. So what is the required score? Like I told you the points, like 6, 8, 2, for all of the criteria. So if you calculate all the top scores, like 6 plus 6 plus 6 plus 8, the total score is 54. But for last year medical training, candidates who had 35 itself got shortlisted in the first counseling itself. First counseling is the first round, and in the second round the score goes even lower, which is like maybe 30, I think. So they got shortlisted at 30 itself. I think this itself shows you, or makes it clear, that you don't have to have all of it. And it is okay if you have some of it, or it is okay if you have none of it also. The explanation I will give it in the next slide. And if you ask if this is the score every year, and if it is the same for surgical training, the competition is a little high, because the waiting list is long. It is not that the score is so high, or this like or it's like very difficult because I'm a non UK medical graduate. No, it's not like that. It's the same for everyone. Just because the slots are less and a lot of people are applying, the waiting list is long. That's all. But it's not like you will not get a surgical training. A lot of non-UK graduates are entering into surgical training, and this changes every year. Like, I mean, the score changes every year, but it's not a great variation. Like suddenly they will not ask you to give 50 out of 54, or suddenly it will not be 25 out of 54. It will be somewhere between 35 to 45 for all the specialties. So this is the required score. And like I said, this is just the first step. After they look at the score, they shortlist you, and then they have an interview. An interview also have some marks. And after the combined score, you can apply for the hospital that you want to do your training at. So this is how entering into training in the UK works. I hope until now I'm clear. And I think this is the most important slide of all. Because all of that was a lot of information. Many of you might think, oh my God, I don't have anything. Like I did not even have any idea. I'm in final year already. Oh my God, I've graduated already. The answer is do not worry at all, because the system in the UK is like completely opposite to what it is in India. Nobody cares. Like I have 8 publications and you have 0 publication, nobody cares. It's like, oh, that's a really good thing, you are really interested in research. That's all they say. There is no comparison. There is no looking up or looking down at people. So do not worry at all. And like I said in the beginning itself, it is not mandatory to have all of them, or in other words, you don't have to need any of it to enter into the UK. To enter into the NHS, you don't need any of it. So but for example, if you have time now, and if you're in your medical school, or if you've not entered into the UK still, and if you've gotten time, you can try fulfilling 1 or 2 of the criteria so that you can score points, and later so that you can be a little free. But no, I do not have the experience, I do not have the opportunity. It is completely fine, because once you enter into the UK, you have to do them. Like there is no option. While you enter into your job is not just going to be going to the hospital at 9 o'clock and coming out of at 5. You do not have that. You have a feedback. You need to take feedback from the patients. That's like compulsory. You need to upload it in your portfolio, and you have to do teaching sessions for your juniors. Again, that is compulsory. So for that, you can claim points anyway. And you need to do an audit cycle. Only if you do an audit cycle, you can finish your internship. Again, that is compulsory. But maybe for international medical graduates, they might not say it is compulsory, but you will be given a chance anyway. Your clinical supervisor or the consultant, the doctor in charge of you, will be asking you, or you can tell them that, sir, I do not have an audit experience, can I please start one? And they're very helpful. Like there is no judgment, or they do, like I said, they do not look down on you. It is just up to you to try. So even if you come to the UK without anything, you will have enough time to finish all of that before you enter into training. That is the last line. Like if you're not able to build it now, you can build them while you're working in the UK, because it's a part of the curriculum itself. And currently, if someone would ask me, like, I'm doing my medicine in India, what do I do? So these are the steps to follow. Building your resume is essential for you to enter into training only, but just with an awesome resume and without clinical experience or work experience, it is very, very difficult to secure your first job in the UK, because your first job is the first step. Only after you enter into your first job, you can apply for training. So to enter into the first step itself, you need work experience and rich clinical skills. So currently while you're doing your medicine, focus on your clinical skills, try to enrich them. Like honestly speaking, people in the UK look up to Indians because they think we know a lot of clinical skills given the number of patients that we see. So focus on that. And if you have time after your MBBS, work in the department that you want to, preferably emergency or acute medicine, because the number of job opportunities is very high. And again, where you're doing your first job is irrelevant to the training that you're going to apply. I want to do surgery and I'm applying for a post in emergency medicine, doesn't matter. You can enter wherever you want and then shift your field or apply for whichever training you want. I'm asking you to work in emergency medicine or try to work in emergency or acute medicine, because the number of job opportunities in these two fields are very high. So if you have time after your medicine, MBBS, work in ICU or in emergency medicine, so you can secure your first job there, and go through this, like finish your IELTS, PLAB 1 and PLAB 2. And then meanwhile, whenever you get the time, build your resume. Do not focus completely on building your resume and leave the most important point of being a doctor, that is having good clinical skills. And the take home messages that I would like to say is, do not stress yourself, follow your heart. You know the answer, like what you want to do. All these things, somehow you will come to know all these criteria and all the things. Somehow some senior in the UK or your consultant or people who are taking PLAB with you will tell you what to do. And so do not stress and do things at your own pace. And please never compare, because it is not like India. PLAB is not a competition. Entering training is not a competition. If 100 are good, they will take 100 also. It's not like there is only one. It's not like NEET. It's not like the undergraduate education that we do here, where there's like 150 and one of them is best. They do not see who is the best among it. They just want everybody to be the same. So never compare, because journey to the UK is not an easy one, not in terms of studying or not in terms of clearing the exam. Compared to NEET, it's like the easiest exam that you can take, but the amount of patience and the mental resilience that you need to have to go to the UK is not simple. Like, you need to have a lot of patience because it is a very difficult journey. Your friend might be able to clear plab or take plab right away. You might have to wait for 6 months, and that 6 months waiting time is such a headache. So never compare. Please focus on your own path. And like I said, it is never too late to start. Even if you don't have anything, it is all right. You can start now, or if you find it's overwhelming already, you can start a little later. And please feel free to reach me at Instagram, that is at Saivo, or it's my email. And we also have a WhatsApp group where we help each other enter into the NHS, that is to the NHS. If you want to be a part of it, I can add you if you're pinging me. So I think I'll stop with this, and you can ask me your questions.
Hello.
Yeah. Just a second, I'll stop screen sharing.
Ma'am, am I audible?
Yeah, you're breaking a little bit. Can you say it again?
Am I audible, ma'am? Can you
Yeah,
hear
yeah,
me
yeah, yeah.
properly?
Yes, 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 you're audible. Just give me a second. I'll stop.
Yeah. So, ma'am, I had a yeah. Okay.
Thank you. Yeah, yeah.
I had a couple of questions, ma'am.
Ah,
I'll start with the first one,
right.
and which is, I mean, it's obvious, it's known to us that booking a plab seat is not always easy because there is a lot of backlog already going on because of
Yeah.
COVID. And as you said, you for building a CV, you need to, if in your home country you start working after your MBBS, after your internship, so in suppose ICU department or any emergency department, it holds a good value.
Mhm.
But then, ma'am, there are two things I wanted to ask in this.
Yeah.
First is there is this thing which is called being over experienced, right? So
Okay.
if you're over experienced in a field, you cannot directly apply to code training. Isn't that right?
No,
But
there is
then,
nothing
if
like that.
as to what I have heard, and because I do have a couple of friends that have gone there, and they've told me that if you are over experienced, which is if you have more than 18 months in a department, say for example, if you have more than 18 months in medicine,
Uh-huh.
you cannot apply for a core training in internal medicine,
No, no, no.
right?
That is
Is
not true.
that true?
No, that is not true at all. Like, your training or your years of experience is that only adds value to your CV or your eligibility to enter into core training. There is no rule like if you have higher experience, you cannot enter. Like, there
Right.
is nothing
Okay.
like that. Maybe I
Okay.
think this person might have completed MRCP along with that. Like, I know my best friend who's applying for psychiatry training. He has a psychiatric hospital and he has 5 years of experience in psychiatry itself, just in psychiatry.
Okay.
But he is applying
Okay.
for core training year one in psychiatry, and there's nothing like that. Like, there are people who have completed their MD and MS from India and taking the plab route. So that is not a really
Right.
right information.
Okay. Okay, that explains. Thank you so much, ma'am. One more question that I had was, for example, I have a research published in IJSR, which is International Journal of Scientific Research. Now, it
Okay.
is not exactly PubMed; it is PubMed cited. It is
Okay.
PubMed cited. So, will I get points for that? Because
You will
I'm the
point,
first author.
yeah, you will get points for that, but it is not PubMed index, so you will not get 8. I think you'll get 6 or 5.
Okay, but it is in PubMed, like it is cited. So, it won't get me 8, but I get
Uh,
points for that,
Sorry,
right?
your voice is breaking.
Ma'am, can you hear me now?
Yeah, like the last line that
Hello?
that just broke.
Okay, so I will get points for it. It's not completely invalid.
No, no, no. Nothing is invalid. Like I said, maybe you will not be able to get 8 points, but you will at least get 2 or 5, or like
Mhm.
whichever is in there. You can claim for 8 points, but whichever they feel hits the right box,
Okay.
they will give you the points.
Okay, ma'am. And the thing is, like, I'm a final year student, and I wasn't very sure about going for any international exams before my final year. Now that
Okay.
I'm in final year, I don't have a lot of opportunities to do extracurricular activities because first thing, my college does not have a lot of extracurricular activities. Secondly, final year does not permit me the time to join different organizations and uh, join stuff and participate in them. So is that like a negative point for me? Will that hamper my CV? Or even after completing plab, if I go to UK in my foundation 2
Hmm.
FY2, can I still apply for job there, and will that also add in? Like, is
So
there
your
something that might hamper my?
Okay. So your FY2 is like
Yeah,
your first job. Your FY2 training might have
right.
requirements, but it's not required that you enter into FY2 because FY2 job is equal to FY2 training. There's no much difference. Your pay is the same, and whatever you're doing.
Right, no, ma'am. So, like, for to apply for core training, obviously they'll be looking at my CV, right? But my CV is completely, I mean, it's not
Can I?
very good looking at this point of time.
Right. Have you completed your question?
Yeah, I mean, the main question was that even though I mean, because I've started late and I don't have a very good CV, will that actually hamper my chances of getting into core training in UK?
That's what told when I started the presentation. Very, very like maybe 1% of international medical graduate enter into training directly. And even if they do so, nobody recommends it because the responsibility level is very, very high. So your first thing while you enter into the UK, the first thing that you do is it's not that you're going to enter into training, you will be entering into a job. And while you are in your job, you'll be applying for training. And even if you have zero, if you have nothing in your CV, this the time that you work in your
Mhm.
job, you have to do everything because only then they will sign your form. So your CV does not
Okay.
matter when you enter into a job. That is what I have been telling in the whole presentation. Like it is okay if you don't have anything right now,
Okay.
because you have to do it anyway as soon as
No,
you.
I mean, yeah, ma'am. That the part where you told us about the foundation you for year two and the form filling, you have to complete all the criteria. Yes, I did get that point, but
Yeah,
the main thing was like it doesn't matter if I haven't done much of extracurricular in my med school. So in my final year or my 4 years and internship, even if I haven't done that, that does not matter, right?
that's what. Even if you have, you do not have, that doesn't matter for your first job. Whatever I was telling was for training, and nobody is going to enter into training.
Okay,
Maybe you can, but that is not recommended at all because of the litigations that they have.
right. Okay, okay, okay. Thank you, ma'am.
Yeah, yeah, no problem.
Hi everyone, can you all please put up your questions on the chat so it's easier to answer all of it? Moving on, we'll be taking the next question. Ma'am, there's a question about BLS and ACLS. Any courses that are applicable or how to apply for such courses in the UK?
Uh, you can just Google for ACLS courses in the UK, and there is from the Research Council UK. They open slots, I think, every month in different like different parts of UK. You can apply for it, but it is very expensive. My suggestion would be, although ALS or ACLS from India is not considered valid, it is considered equivalent for your first job. Currently, as medical students or someone who has not entered into the UK, your aim should focus on securing a job, because that is the pathway to enter, and not securing into training, because that is, nobody does that. Maybe if you want, you can try. I'm not discouraging you, but like I said, it is quite dangerous to get a job in the UK. You can do your ALS course from India and update it in your profile, and later while you're doing your job, you can apply for ALS courses in the UK and do that, because the ALS course is quite costly in the UK. If you're going to do it by yourself, you have to pay, but if you've gotten a job in the UK, your hospital will pay for it. The best thing that you can do is apply for ALS or ACLS in India and get a certificate for that for now.
Okay, ma'am.
Or if you want to do it in the
Oh,
UK, you can just Google ACLS courses in the Research Council UK, and there are so many slots. You can book it. You need to take a visa, go to the place, because it's 1 day online and 1 day offline. Do the course and get the certificate.
okay. Thank you, ma'am.
Yeah.
So, moving on to the next question, people have been messaging on the chat asking if you could share the presentation or the WhatsApp link of the group that you'd mentioned for the NHS.
Uh, oh, I do not have the WhatsApp link right now. I can maybe put it in the group, like the resume group later.
Sure, sure.
Yeah.
Okay, thank you. Moving on to the next one. Are there any course certificates from Coursera, EDX, or some other online websites that are helpful in our resume?
Yeah, it is helpful. Like I said, they do not get you any points, but it makes your profile look good, and it is required for your first job. So courses from edX and uh, like reliable websites are considered useful. There are so many free courses. Prefer the free courses, because again, it's not mandatory. It will just help you get your first job. Does not give you any points while you apply for training.
Okay, ma'am. Thank you. Moving on to the next question. How will the distinction be calculated? Suppose if what is the proof that you have to show, you're in the top 18, like
uh,
the top 18%.
So I think if you get a distinction, that will come in your mark sheet and you can submit it. And if the college gives you a certificate or the university gives you a certificate, you can give it. If you get a gold medal, obviously the university will give you a certificate that this person has gotten it. You can submit it, which means, of course, everybody knows that they're not going to give gold medal for everyone.
Yeah.
So
Okay.
we can only submit whatever we have, and whichever we think is connected to whatever we are claiming.
Okay. Moving on to the next question. If a person is directly joining at an ST3 level after MS in India, is there anything else that should be taken into consideration, like based solely on your CV?
So MS in India is not recognized in the UK. MS or MD is not recognized, but your years of experience will count. Like the other person was telling, if you have like so many years, like 18 months or 2 years of experience, 3 years of experience in that field alone, you can apply for ST3, which is ST3 is third year of training, which is the registrar
Yeah.
post. Like instead of going to first year PG, you can apply for third year PG, but it is again not very easy because the responsibilities are very, very high. The registrar is like the person who's in charge of the ward, and at nights there is only two registrars for the entire hospital, and it's not like India. So it is a little dangerous to straight away go to a higher post in the UK. Even MD assistant professors from India, they start at ST1 or FY2 because they ask for it, but you can apply for ST3. The additional qualification that you have to have is completing your MRCS or MRCP, at least step 1 or step. You cannot directly go
Okay.
into ST3 without clearing one of the UK PG exams, and you can take it whenever you want. Like for MRCP 1 or MRCS 1, the requirement is 1 year of internship, which we all have, and for MRCP 2 or MRCS 2, the requirement is 2 years of work in that specific field, which of course someone as an MS in India will have.
Okay. Okay, ma'am. Also, the next question is something about teaching points. So, should the feedback form have to be from every student separately or collective form? What would that be?
So there are two ways that you can submit proof for your teaching. One is you need to get a certificate from, like, you did some teaching in a college or some institution. You need to get a certificate that this person has done teaching for this many students for these courses for this given time. Otherwise, for example, if you're doing teaching for a group, you need to get feedback from individual students with the date and time and the, like, for example, the topic of it.
Oh, okay. The next one is regarding clinical attachments in the UK. Do they have any points as such?
Clinical attachments in the UK is again a very hyped topic. During COVID, okay, this thing happened. Like when there was COVID, no doctors were going to the UK, and they were so much in need. So they started this clinical attachment trend. Oh, 1 second. I'm sorry, I forgot the video.
Yeah.
Yeah, so during COVID we had like there were no doctors who were going to the UK. So what UK did, or what the NHS did, they started this clinical attachment thing, which is like
Yeah.
2-3 weeks of observership in the UK. Observership is like what you do when you're in your second year or third year. You go around with the doctors, you look at the patients, but you don't do anything at all. You cannot even prescribe them medicines, or you cannot even do an IV or a catheter. You just look at what the other doctors are doing. And because there was a high shortage of doctors, whoever did clinical attachment, they just recruited them directly because nobody was entering because there were no flights. Currently, everyone is doing a clinical attachment, and it is not greatly of any use. I cannot tell you 100% you will secure a job with a clinical attachment, and it does not have any points. Like, for example, you applied for clinical attachment in different hospitals, you got in one, and this is the time. For example, it's August is recruitment period, and you're doing your attachment in June or July, then there is high chance you will get a job in that hospital, because during August there will be a requirement. But you do an attachment in January and they will only recruit in August, they will not be preferring you, because during those 5 months there might be other doctors, or it is not an assurance that you will get a job. You might get a job, that is what I'm trying to say. you might not. The chances are very low nowadays because there is a lot of people who are doing attachment. Second point, direct answer to your question, do they hold any points? Nothing.
Okay. There's a similar question following this. Does doing observerships and electives in India hold any value? So like there have been observerships in India and like an international exchange and any sort of that thing. So does that hold any value as such, or
Like I said,
just the
not,
experience?
yeah, not specific value, like you will not get specific points, but maybe it will make your CV look good. Okay, this person is really inclined in getting into this field. Like, okay, he has gone somewhere, traveled somewhere to do an observership in this field because he's very interested. It will give that impression, but it will not give you any points. Maybe you can quote it while in your interview or while you're securing your first job.
Okay, so I think those were most of the questions. If there are any other questions, you all can put it on the chat here.
I think there's a new question.
Is a medical transcript required while applying for a job or for training? Because some colleges like has not provided it as such, the transcript.
Okay, from my knowledge, medical transcript is a record of what you do or the rotations that you do with the dates that we get after every year. That is required for USMLE, not for UK. And even if you guys are interested in going to the United States, the marking that they give for the criteria is more or less the same. Along with this, you need to have some extracurricular activities. So, but the CV, we talk about that we don't give importance in India, but across the world is this, like your presentations, publications, teaching, audit experience, and extracurricular activities. And a medical transcript is for the United States.
Also, there's another question. If we're doing MS in India, should we log in all our surgery cases done in India? Is it taken into consideration for the CV or just for the interview?
No, it is not taken into consideration for your CV, but sometimes in some institutions, they might ask you to submit your logbook. So that time you might need it, but it is not required everywhere. Some institutions, they will ask you to submit your logbook.
Okay, I think that would be the end of the session. Thank you so much, ma'am, for the detailed and insightful talk on this. Like the way you broke it down into steps was, it made like a view a little more clearer as to how to go about it with whatever queries that we had. And as correctly said by you, even if you start now, even if you have nothing, it's better to start now. Like you can still read somewhere. So that is like one point I would also take from this personally. And it was a pleasure to have you here. Like you made it like very clear for us to move ahead with that.
Yeah, I hope it was helpful. Thank you for the chance.
Thank you so much, ma'am. Leave the chat for a while.
So if you are done, I think we can end.
Yeah, we can end.
Yeah, okay. Bye.